folks. This is Steve Sanson, Jim Jonas with Veterans in Politics. Today we're going to have Christie Stucke. Stucke. I call her Sticky. I call her Stucke, but it's Stucke. She's going to talk about the Medicare enrollment. And before we get to our guests, Jim, you got anything?
Yeah, just real quick, I just want to get this out, and I know you have some stuff you want to talk about, Steve, but one of the things that I swear I'm going to stay off Facebook, but that's actually never going to happen. But one of the things that stuck out is that you posted something on Facebook about how you put Bill Kephardt's.
Oh, A-frame in front of my house?
Yeah. And there was a couple people that responded, and they said that Judge Kephardt he's just as much to blame as Doug Herndon for, you can go back to past shows to understand that. And where I disagree with that on is because we actually asked Judge Herndon to come on and explain himself in a case. And
you're talking about the George Steeds case.
Right. No. And he didn't do that.
No.
Now, Bill did.
He did. He came on.
He came on, he explained it.
His part. His role in it,
yeah. So, I mean, for me, that should just be squashed because Bill came on and he explained himself. So he's a stand-up guy, and other than that happened years ago, like, I don't know anybody that has ever said that Bill is not a fair judge.
Yeah. So
I think his record speaks for itself. And I am a strong supporter of his, and so I just wanted to get that out there.
Okay.
Really, that's all I honestly have to say.
Okay. Well, I have a couple things.
Okay.
First, Katie Williams, I'm wearing your shirt. All right, make education great again. Katie Williams for was it Trustee A? Was it B? Trustee B. Clark County School Board. And then the second thing I wanted to talk about, today's paper. Yes, I'm in today's paper again. Oh, well, not today's paper again, but I'm in today's paper in the news again. Alex Gabato, an attorney that has history upon history, upon being reprimanded, blah, 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 suspended and all that. The Review Journal did a good story about trying to explain why he was reprimanded, but they were talking about 3 different cases that came up to his being reprimanded, and the only name they mentioned is mine, but they kind of put me in a false light because they didn't really explain. They didn't explain that I'm the one that filed the state bar complaint against Alex Gabato once I found out that it was unethical for an attorney to give non-lawyers payment. They didn't explain that, and they didn't explain that I'm the one that gave the Review Journal the information to help orchestrate the story that they wrote. So they kind of left those 2 items out. I just wish that when they do a story that they explain it fully so the readers could understand exactly what's going on and not to assume anything that isn't really there. So they kind of left it to the imagination, which a good journalist shouldn't be doing that. So I just wanted to say that.
Okay.
And then I wanted to say today is my buddy Steve Jonas' birthday, and I want to tell him happy birthday. How old is he now?
I believe he's 38.
He's getting old, but you know, Botox could fix any kind of wrinkles or anything like that he might have. But happy birthday, Steve Jonas. Just wanted to say that. So now we back to Christie Stucke.
Stuck.
I was stuck on your name, Christie.
You're stuck with me. That's just how it is.
I'm just stuck with you.
Yeah, okay. Absolutely.
That's a good stuck, right?
Absolutely. You'll be with Lucky Stucke.
Oh my God, that sounds like a good slogan, Lucky Stucke. You plan on running for office, Lucky?
Maybe, who knows? It might need some good people there eventually.
You need good people all the time.
Absolutely.
Yeah. So give us a bio, and why are you here?
I'm here because I am working with Las Vegas Medicare Pros, and we are working to educate the community this open enrollment season as to the changes in Medicare, so that people will be aware and come out, or we can come to them, and we have different ways to help through this COVID pandemic to assist seniors in the safest manner possible, and also to make them aware of the plan changes that have come to Nevada this year and why it's so important to get out and check and have a plan review on your Medicare, whether it's with our agency of Las Vegas Medicare Pros or whether it's with your agent that you normally go to. Get out, make your appointment, get with your agent, because this year is special and different, as you've heard in other years.
Christie? Maybe I should have just said, give me your bio, and then ask why you're here.
Exactly, yeah. My bio is I've worked in the medical industry for over 18 plus years in the radiology market, and I recently started working in the insurance.
About you.
Yeah, I have that. So I work in technology and IT, and I got into the Medicare insurance world this year because there's a great need, and they need help to get information technology to seniors. Everybody's working with Zoom and new technologies to try to meet the demand. And healthcare is a big important thing to our seniors and to our community, and it's difficult this enrollment season, and a lot of agencies are struggling to get technology to these seniors just to help them make sure they're on the right Medicare plan to get their needs met. So, and this year the government has changed things greatly. They've changed it because it used to be that you could, as a Medicare agent, only do open enrollment periods that they assign, which is a couple months during the year.
Is this part of Blue Cross Blue Shield or any specific?
This is part of the government's Medicare program from CMS.gov. So they have implemented
changes. It's not the
changes.
Obamacare program, is it?
It's related to the Affordable Care Act, obviously. Keeping your pre-existing coverage and things like that is all related because the carriers have to abide by what the Affordable Care Act stands for. So, and CMS.gov oversees the Medicare plans.
What does CMS mean?
That's the Central Medical Systems for the government. They are managing all of the Medicare and plans and making sure that the carriers, being like Blue Cross Blue Shields, Aetna, Anthem, all of these carriers have a requirement to abide by their standards. So what has changed, and why do you need to be concerned about Medicare this year? Why is it different? Because very simply, they are rolling out what is called special needs programs, and they are allowing us to serve Medicare patients year-round now. Okay. We're not just limited to a certain enrollment period now. If you fall under low income or special needs or chronic condition, such as diabetes, lung issues, heart issues, etc., you now can get and change plans to what is called a chronic special needs program or a dual special needs program, which means that you are elderly as well as low income, basically. And what does that mean to the Medicare beneficiary? That means that that 20% that you used to have to pay, gone. That means the deductible that you used to have to pay is gone. It zeroes out to zero or no cost or very low cost for any out-of-pocket expenses. So if you are struggling for food on a regular basis and you're spending $80 a month on medications, this could be life-changing for our community and our seniors here if they are low income and they do have both a Medicare card and a Medicaid card. They need to come out and change their Medicare program to a Medicare Advantage plan that is a dual special needs program in order to provide them with zero to little cost health care and Medicare benefits. And like, I'll give you an example. If somebody, for example, wasn't going into a nursing home because they couldn't afford the 20%, and because of a low income situation, they will now be able to get that and do that and have those services because that 20%, the cost sharing is gone. So that's huge. And so not everybody's aware, and it's not yet hit the papers and the news. It's about to. We're doing some news things with the Las Vegas Review-Journal. And so you're going to see it coming out soon, how our organization is doing things to help the senior community be educated and know what D-SNP and C-SNP are, which is the acronyms being utilized that you're going to hear a lot more of. It's going to be on everybody's lips and tongues, and they're going to be talking about it. And it's going to happen for the next 3 to 4 years.
What does that mean? D-SLPs and E-SLPs?
D-SNP, which is DSNP, or CSNP, stands for Dual Special Needs Plan, or Chronic Special Needs Plan, which cover both the low-income seniors under the Dual Special Needs Program, and then the chronic are the ones that need special care. So the government's come out with these new programs that say, if you have a lung condition or heart condition or diabetes, we're going to have special programs to help you with your care that are more in tune with your specific situation, and spend more energy and efforts making sure that these types of drugs are covered on your formulary plan properly, or that this type of care.
COVID?
It's not just, I think, because of COVID. They had been in the works for this for some time to expand and help cover more seniors that met low income requirements but did not maybe qualify for Medicaid. And so if you qualify for Medicaid and you have a Medicare card, you probably qualify for one of these dual special needs plans. If you don't have a Medicaid card, they still have what is called a low income special needs plan, or LIS. So you still may qualify as long as you're up to the 133% of the poverty level. And I did bring the amounts per household with how many people are in the household that you have to be under to qualify.
Sure, let's talk about it.
Do you want me to go ahead?
Well,
and where's your water? You have a water?
Yeah. Mm-hmm.
Oh.
Yep, I do.
before you get
Yes.
into that, first off, thank you for coming on. Now, I consider myself a fairly intelligent person, but everything you just said went just completely over my head.
Okay.
So this is something that I've been dealing with for a long time. There are a lot of government programs out there, but there's all these acronyms that you just brought up. Like, I'm just gonna be perfectly honest with you. Like, the average person has absolutely no freaking clue of what you just said. So if you're a person with a lung condition, let's just say that, how do you know what programs you qualify for, and are there any people that you can call to help with this? Because there's a lot of wasted money, in my opinion, that, like, there's all these programs, but, like, most people don't know how to apply for them or anything like that. So, like, how do they even go about finding all these programs?
So that's exactly why I'm here, because I am trying to educate people on where do you go, who do you call, and it comes back to that you need to call a licensed certified agent. They are certified.
Who is that?
That is any insurance agency or broker that is licensed and appointed with any of the major carriers.
Person is?
Well, you can certainly call Las Vegas Medicare Pros for number
Okay.
one, so we're available. But if you look up Medicare, I'm sure you see all the ads out there. The first thing for anybody to check is make sure you're dealing with a licensed and certified agency.
Okay.
And you can look the agent up on the website on nipr.com or .gov. And you can go there and search for the person's name to make sure they're a licensed agent and that they're certified to work with you. And then additionally, the agent should be appointed with the carriers that you want to work with. So for example, if you're the two big carriers here in our local area are Humana and United Healthcare. Okay, so a lot of people are divided between these two.
So how do you know what you're supposed to be dealing with? Like, I mean, like, honestly, like, so if you're just an average person, or say you're 70 years old, like, how do you know, like, United Healthcare, that's the person you're supposed to work with? Like, how do you know that? How do you know your coverage?
So that's, again, coming from a licensed agent. So what happens is once you get to the point, like seniors, they become eligible for Medicare at 65, or if they have a disability, they can get on Medicare sooner, okay? So once they start to get on that list, they will, trust me, get a number of mailers and mail coming to them, both from the government as well as from different carriers, advertising to them, hey, come with us, get on our plan for Medicare. So you've got the government program, which is Medicare Part A and Part B, okay? That's the original Medicare. So when you're talking about Medicare and understanding the programs, because I know you said you want to try to understand what is the difference between Medicaid, what is the difference between Medicare, what is the difference between Medicare Advantage versus Medicare. So just to kind of give you a general summary to help you better understand healthcare in general for our seniors and in general for our community. Medicare, original Medicare came out where you would be paying into the Medicare program and it worked to provide health care when your elderly years, and that money is coming back to you to help pay for your medical coverage for hospital stays and drugs. Everybody qualifies for that. So when you turn 65, if you've worked 40 quarters within your lifetime and contributed to it, and you would be eligible for Medicare here in our country. But unfortunately, you know, when they created this program, they realized that they needed to cover more people and more services. That wasn't very complete. They weren't covering everything that a patient might need in their elderly years, and therefore that's when private carriers got involved into the government program and said, hey, we can provide your Medicare beneficiaries much better coverage, much better services, and they came out with the Medicare Advantage plans. And they're trying now to get everybody that's on the original Medicare program onto a Medicare Advantage plan so that they will get more benefits and more capabilities within their plan than they're getting with just A and B alone with their benefits from the government. And what is happening is the government is then contracting with these private carriers and paying them for their plans at a much lesser rate, and sometimes even rebating or benefiting the beneficiary back. For example, there are some private healthcare plans that even provide rebates of $50 to $100 back each month of your money that you would have for, let's say, drug plans. So your drug plan is only costing you $44, you're going to get $100 back every month. And those are programs available for even veterans. We have specialty programs. If you are on TRICARE or you're with the VA and you're getting most of your needs met, but you need some supplemental, there are rebating programs where you get your drugs from the VA and the TRICARE, and then you can get a supplemental drug plan and get $100 back of your Part D money every month back in your check. So, and there are other programs that are even this year, for the first time ever, we have one carrier alignment that has come out with a completely telehealth virtual plan. That's never been done. It's the first time ever. So if you're low utilization, you're pretty healthy, and you don't need to go to the doctors a lot, you can save a huge amount of money, and you can go with a completely digital plan this year that's never been offered by a private carrier before. So that's new and different, and that's going to be a huge savings. And they're doing creative things like giving you an iPad and they'll save your $100 rebates that you would get for 3 months. They have things like that. So there's all kinds of benefits, and that's really what it's about this year, is all these benefits. Because also, one of the 3 major things that are going to make people come out in droves over the next year to 3 years to change is going to be dental, vision, and hearing. Currently under here, it's not covered. You don't get it with A and B. If you go to the private Advantage plans this year and you're dual special needs, you get all of that covered, and up to $4,000 of dental. And so many seniors need dentures, so many seniors need comprehensive care, and many of the other plans require you to put out that money, which they don't have up front, and then get reimbursed. These are comprehensive plans that don't require any out of pocket. And then they'll be able to get the health care they need both for their vision, and this year they're providing hearing aids. They didn't used to provide that, so they have a low-level hearing aid that's covered completely with no out-of-pocket cost. So these are things that if they qualify and they're eligible, we can go over these ancillary benefits. And we have one carrier even offering pest control and dog sitting, as well as transportation, unlimited to and from appointments. So these are important things that if you were go to Medicaid, there's a limitation to how much Medicaid is going to cover. There's a limitation to how much Medicare in general, the original Medicare, is going to cover. But if you switch and you are eligible for any of these special need programs, you can see what you might have been spending for medication and for care go to a zero cost, which will put more money back into those beneficiaries' pockets that need it the most, which are our low-income seniors and our seniors with health problems that need special attention and special drugs that maybe aren't covered underneath their current formulas and plans. And doctors are incentivized as well to have their patients go this route, because it used to be doctors were telling their patients, keep your old Medicare, don't change to Advantage plan. Why? Because the doctors make money every time that patient comes in the door, and they were making a lot of money. So now that COVID has happened, they're not having the patients coming in the door anymore. And so this allows doctors, if they can please tell their patients to get on a Medicare Advantage plan, because they will make money even whether the patient shows up or not. The way that reimbursement works with an Advantage plan is that whether the patient comes in or not, the doctor is incentivized to keep them healthy and not coming in. And not having them come in all the time, because they get paid per patient per month. So now doctors are going to have to think about how they've been handling their patients and their medical benefits, and pushing them more towards this plan, which is going to service their needs better and service their overall financial needs as well. But until the community as a whole becomes aware of these changes and aware of these issues, both on the physician level and on the patient level, you might still have this old mentality from patients and doctors saying, don't ever change your Medicare Part A and Part B. Or you won't be covered. And many of the doctors that said, I won't participate in these private health care plans, I'm only going to take Medicare Part A and Part B, are now rethinking and saying, hey, I want to get on those networks. I want to become part of these private carrier plans, because now I'm not having patients come in all the time, and I'm having less patients come through my door. So on a grand scale, this is almost unbelievable with the amount of benefits and services that are going to be provided for low-income seniors. I almost have to tell them it's not a joke, it's not a fraud. You actually will pay zero across the board for your health care if you qualify for one of these plans, but you won't know, and you won't be able to change unless you meet with a licensed agent, a licensed Medicare agent or agency, because they're the only ones legally allowed because of Medicare fraud, waste, and abuse. You have to deal with a licensed agent to make those changes. And right now, our community, and this is why we're also being looked at in Clark County and Las Vegas as a whole community, is being looked at all across the U.S. by other agencies and other organizations and businesses looking to come in from outside and capitalize on this market, because we have one of the highest, over 65,000, they're estimating, people in Clark County alone are going to qualify for these dual special needs programs. And the government is paying these private carriers, so whomever picks up that business and helps these 65,000 people transfer are going to be the ones that benefit. So as you can imagine, we have about 300 to 600 agents here in our local area, which is doubled in the last, for this enrollment period. Yeah. But it's so unique, and people don't understand how unique this is. The Medicare market is changing, and it hasn't been talked enough about in the news. It's just now starting to come out because open enrollment has come. But if you're not aware of it and you've not heard the words D-SNP or C-SNP, then you need to be understanding what it is and how it relates to our community and our seniors and our healthcare, because it's huge. Even if you're homeless and you have a Medicaid and Medicare card, you qualify, and you're going to be able to get that healthcare and that assistance that you need, and all of those ancillary benefits and services that I can go over, in detail. I brought some plan books if you want to hear just some of the things that they're covering and which plans are offering what.
Sure, we could go over a couple of them so we can.
Yeah. So.
Well, what's PPO?
PPO is when you can choose. There are different types of provider networks. So preferred provider option network is a PPO where you can choose any doctor that you want, and if they're out of network, you pay a different price, and if they're in network, you pay a certain price, but you're not really limited to who you can go to with a PPO. With an HMO, you're absolutely limited to the people within the network. So you have to work with the physicians in the network. If you have to go outside the network, there's usually a referral process and a special needs analysis done for that. And then we have other plans that are indemnification plans where you don't have to be with anybody in network. And there are new plans like that. Like, let's say you're not elderly and you're not on the Medicare side, but you're looking at health plans, and they have new things out now where they will send you a black card that works like a credit card, and they have a list of CPT codes and how much they pay. And just to give you an example, they have to pay out. So if you go to a doctor's visit and the indemnification plan pays $50 for the doctor's visit, and you go up to your doctor and say, hey, I'm a cash pay customer, will you do it for $25? And you hand them the black card and they charge $25. That pays $25 to the provider and then $25 back to your account, because they have to pay out that full $50. And so you can actually, even with some of the new healthcare plans, make money and pay for it. That plan runs between $165 up to $279, depending on how much benefits you want per year. But like the low end is $10,000 a year, and the middle side is $25,000 a year in benefits, and the top side, which is $279 a month, you can get $2 million of benefits a year, and they cover all of these CPT codes. And you just take this little black card, and you're not limited to any doctor, anywhere you want to go. And so there's different programs like that, and people aren't even aware that these programs exist.
Could
and they
you use
might
them
even
outside of the country?
Some of them do have availability for travel and outside the state and the country. For example, Aetna is one of the few that have a program where a lot of people go over to California, to Berkeley, and to other institutions over there. So
That's
they
another
do need.
country.
Yeah, it is. It's going to be, right? So, but the benefits are looked at on a per beneficiary level. So when you sit down with a licensed agent who is educated, who knows what they're doing, meaning there are plenty of agents out there that sell everything under the sun, and they're just doing Medicare as a side income piece. And then there are people like us with Las Vegas Medicare Pros who specialize in this, who have gotten extra special training on how to work with Medicare recipients and help them with their best benefits. And we're appointed by all the major carriers, so we can really take a look and see, okay, what's important to you? If it's that you have to go to the doctor every day and you need unlimited visits, this is going to be the plan for you. If you need dental is the most important thing for you, well, then this is the best plan for you. So we look at each person's specific needs, and we do an analysis to figure out, okay, what are the drugs you're taking? How much are you spending on the drugs? Any good agent, if you go and sit down with an agent, if they're not doing this for you, they are not doing their job. So if you're a senior and you sit down with your agent and they're just trying to quick do your app and get you out the door to make that money, stop. I want a needs analysis. I want you to do a cost calculation on my medications, and I want you to check before you change me to any program, make sure my doctor is on this network plan that you're putting me on. These are the two major things that affect seniors when working with Medicare agents, that they don't understand or know what they should be asking. They're having somebody guide them and lead them, and oftentimes that part is skipped, which is causing the most amount of aggravation. If you've ever been in that situation where your coverage has changed, you go to your doctor and they're like, oh, well, we don't take your type of insurance, and then you're out that visit that day and you're going, what happened? Why am I not able to go to my doctor? Why is my script not covered? I don't have the money to pay for this script. So that happens all the time. And I think if seniors are educated to what's going on and what they should be asking their agent and who they should be talking to and what should be covered in their meeting when they sit down with an agent, we'll have better informed seniors. We'll have seniors making sure that their care isn't interrupted when changing a plan. And then they're going to get them on the plans that make sure that they get them the maximum amount of benefits. And they can only do that if they've done that proper needs analysis and figure out what is this senior's needs. Are they low utilization, low medication? Do they not care who their doctor is? Well, then you can kind of put them on any plan is going to work for them. So pick the thing with the best benefits that they want the most. If they have a specific doctor and specific med needs, and then it might be that this is the only plan this doctor is on. So this is, if they really are attached to Dr. David, then they need to go be with Dr. David, and you want to service their needs. So that's always comes into a factor when you sit down and look at the plans and the provider networks that are part of those plans.
So when it comes to mental health, in network and out of network, as long as you're doing teletherapy, it's usually a no copay, right?
Yes, with many of the plans, they do have a zero copay for the telehealth. And many of the plans now, especially with like the All Well Care Centene that have worked with our local partners in practice and healthcare providers here locally, have created plans that include a behavioral health and referral out to mental health, meaning that many seniors are scared to talk about anxiety, depression, especially in COVID going on right now, and their fears, because many seniors are worried that if they come off crazy, they're going to have their independence taken away from them. If they're coming across not stable, they're going to be put in a nursing home or you know, and they're scared of that. Yeah, absolutely. So if they are under treatment with physicians and groups and practices that are addressing that behavioral health and helping lead them along the route to the right people, that's super important for our seniors today. So there are a few group practices here that are going over and looking at the overall mental health and overall physical health of the patient, not just the medical side. So I can even direct seniors to those different programs. There are community places where they can do Tai Chi in a COVID compliant manner, or yoga. So social is so important for them.
Is that covered with your insurance?
Yes.
Tai Chi and yoga?
A lot of them are covering. That's the new benefits they're covering. Wow. A lot of them are covering actually gym memberships.
Gym memberships?
Yes, gym memberships.
Yeah.
So they have the Silver Sneakers program, which is one program which will actually pay for a gym membership at any of the major gyms and cover that full cost. So yeah, seniors.
What about if someone that doesn't want to go to the gym but wants to exercise? Would they supply the funding for the equipment?
Absolutely. So
Really?
they do have programs where they will send you a book actually with all of these great things that you can do at home for home health care, with videos and yoga mats, and they'll give you that money that would have gone to your membership. They will reimburse you for that equipment so you can be doing those things at home. And these are all the things we can tell them about.
How does one know that? I mean, how would you know?
They got to talk to their agent. The agents are the ones educated by the carriers.
Let me pause real quick. Thanks for, so I guess I was missing the point. Like, so how do we get this agent? Like that's where I'm confused. So there's all these programs and like and I get it. Like there's all these programs, government programs out there for everybody, and a lot of people don't take advantage of it. And I know I'm one of them too. But so how do you find this agent? And so
you can actually just go to the cms.gov website.
So how do you make your money though?
We make our money when we help, we work on behalf of the government and the carriers are the ones that pay us on a per application basis to go out and assist these people.
Okay, so I'm a confused person, which obviously I think.
Are you an agent?
I am an agent, yes.
There you go, Jim.
So,
right there.
so I'm confused, and like I want to like explain my health concerns and see what I qualify for. So then how would I get in contact with you? So you would be like the middleman, I guess, between the government and tell me what programs?
Absolutely, we are. I'm certified with CMS, and I'm also certified with their Get Help program. So I actually even help people that come through the cms.gov website, and they refer them to me when they need assistance, or through the Nevada link, which is our local Nevada link, but I'm licensed in multiple states to help multiple people in different states. But this is very important. So how do you find an agent? Well, you can certainly look up Medicare agent and you'll come up with a boatload of agencies and things like that. Right. Obviously, Las Vegas Medicare Pros, we do have an office at the Boulevard Mall near the Sequest and the movie theaters that you can stop in there. It's a subsidiary through the Smart Buy Insurance Agency. Most insurance companies can direct you to who is doing Medicare and direct you to an agent. You can also get on the carriers' websites. If you have Humana, if you have UHC, you can look to them, and they will actually funnel that. If you're already with a carrier that you like, they will push you to an agent so you can talk to an agent directly. You can even talk to and call your carrier, and they may be able to answer certain questions about benefits. You can also look to your book. Like whenever you sign up, you're going to get a book similar to this, like I have the All Well book here. And if you want to know what your plan covers, then you're going to want to open up the book and look for what is called a summary of benefits. So everybody has these in any plan that you get those big old packages of information. Right. What do you want to look at in there? The thing you want to locate and find immediately, regardless of all the other print, is your summary of benefits. And it's going to look something like this, with all kinds of numbers and lines and like a little chart. As you can see here, this is just one from All Well, and then this is their HMO plan. And here you can see monthly pay premium, plan premium. This is 0, you know. So it's going to go over all your benefits. Like this one has a maximum out of pocket of $7,500. So there's a lot of terms and things that go into your health care plan.
So there's a big difference between copay and deductible.
Yes.
Because if somebody has a copay and no deductible, then they could go right away. But if somebody has a deductible, then they have to meet the deductible before they could start on the copay. And sometimes that's confusing because some people don't even know that they have a deductible or what the amount of deductible is, or if they already put money into the deductible as out of pocket. So how does that become clarified for any customer going to go see a new doctor?
I think that's really an important part of educating our seniors and our community as to what that means. So that's why I'm trying to get out, and I'm going to start doing some web podcasts as well, some basics on like, what is a deductible? What is a maximum out-of-pocket expense? What is a copay? What is a co-insurance? What does in-network mean? What does out-network mean?
And then PPO and Medicare.
Exactly.
And Medicare, and what's the other one? Medicare, Medicaid.
Yeah. So and then there's original Medicare and Medicare Advantage. So an agent can certainly help answer those questions for you. There's a lot of information online. You can always go to cms.gov also to read information. But if you want somebody to break it down in more simple terms, that's what I'm trying to do, because I agree it is confusing for a lot of seniors and a lot of people to understand what these programs are,
and there are a lot of folks, because of COVID, don't want to go deliver their baby in hospitals. They want the midwives to come to their home to deliver babies now because they don't want to get COVID.
And that's the other thing that I want to talk about, because we're doing the first thing that's ever been done here in our local community in the state of Nevada. We have retrofitted, you know, the bus, the people movers that you get on the party buses. We've retrofitted the bus to be COVID compliant with antiviral misting sprays and a plexiglass dividers to create a sterile environment that we can drive to these facilities.
Christie,
and people can come out.
Could I ask you something?
Absolutely.
Why did it take an epidemic for people to start wiping their ass?
You know, I used to be a child care teacher.
I mean, handle rails in the bus.
I can't resist. So, like,
I totally agree with you.
We've talked about this, Steve, but it's just interesting that.
I've never seen anybody clean handle rails. New York City subways.
Yeah, right.
I have never seen anybody clean a subway before.
I think it comes back
and
to...
this is a germaphobe, by the way.
I think it comes back to education great again, like your shirt, make education great again. When I was a preschool teacher, I taught my kids how to wash their hands.
Right.
And I think it comes back to that.
Say the alphabet song when you wash your hands.
Teaching people how to wash their hands and not spread germs is a huge part of preschool
up until
development.
Today,
so.
I still see people go in the crapper and pass by the freaking sinks. Really? What a nasty bunch of folks.
Absolutely.
The first thing a parent should teach your kid is proper hygiene.
Absolutely, absolutely. I definitely agree with that. But if you're dealing with a situation where you're trying to take extra precautions, we are trying to go above and beyond. And while they're having nursing centers and senior care centers and senior apartment housing where the seniors are afraid to come out, we are coming to them with this vehicle. It's called MERV. It's a mobile enrollment registration vehicle, so that we can come to the seniors that are afraid to come out and go to an insurance firm or go out to the mall to our location. So we can come to them and we bring the PPE for both them and us. We do outdoor visits where we'll bring a table and chairs and we can do a visit with them outside. So we've come up with multitude of ways, everything from Zoom to virtual to coming to them with this vehicle. to groups, and we even bring a yogurt truck with us when we come. So we're bringing healthy snacks with us when we bring the mobile registration vehicle out.
I wanted the truck outside so we could take a photo, and you didn't bring the truck.
Yes, they're finishing the wraps on it, so it wasn't available today, but we will provide you some footage that you can add on the end with the footage of the truck so that you'll have the pictures and the video of the walkthrough of the vehicle. Well,
you know what, it was great having you here. I think we learned a lot. Did we miss anything besides Jim's question?
Yeah, no, it's not a question, it's a statement. Oh. And I know I asked a lot of questions, and some of them are kind of tough because like it just gets confusing sometimes. Mm-hmm. But here's the thing, I really appreciate you coming on, and I'm gonna tie this back to something that Steve and I have been trying to get people to Steve longer than me, I admit that, trying to get people to understand for a number of years when it comes to voting. Like, you have to educate yourself.
Yes.
There's so many tools, there's so many avenues, there's so much information out there now. And the reason why I bring that up is because there's so many people that always just say this to me when it comes to healthcare in particular. It would just be a lot easier if we just went to a one-size-fits-all, government just take everything over socialized medicine. I'm going to tell you that's not the way to go.
Oh, okay.
Okay. That is
scared me. I was about ready to drop off my chest and get a heart attack.
That's not the way to go. You have to be able to educate yourself. And so one of the reasons why I brought up seniors is because I really want to challenge all of individuals out there that aren't seniors, like myself, Steve. You know, one of the things that is very unfortunate in this country, in my opinion, is that we as a younger generation don't take care of our elders. So, for instance, my grandma is now 90 years old, right? She's going through a lot of stuff. She does not understand anything that you just said.
Right.
But I do. And I can do that legwork for her. So people out there, take care of your parents, take care of your grandparents. Like there's a lot of avenues out there. And so just like with voting, you have to educate yourself. Know who the hell you're voting for, know what they stand for, and the same thing with healthcare. Like there's plenty of tools out there that's available to you. Do your research. Government does not have to control everything. It's actually the problem. We just need to start being more diligent and educating ourselves. So I just really want to thank you very much for coming on.
Thank you, and yeah, and that's absolutely what brought me to this business and industry is that my mother was a paraplegic. I took care and was a caregiver for her for my whole life. She broke her back when I was 2. And I also care for my 78-year-old grandmother, and I do agree, we do have to take care of our elderly. We have to educate them, and in fact, most of the times elderly their plans are being managed by their younger children. And so it is important that you are educated on what Medicare is, who to contact, how to make sure that your parent or your loved one's getting those benefits. And if anybody tries to sell your elderly parent Medicare and they don't understand, or you are their point of authority or contact or power of attorney, make sure that because Medicare agents are licensed and they're supposed to not be selling or doing anything like that if the person isn't capable of making those decisions for themselves. So it definitely, we are told we cannot do an app for somebody if they're not able to make cognitive decisions. So yes, absolutely, that's what I'm trying to do. I want to educate and I want to bring people up to date both on the before 65 level and after 65 level because healthcare affects us all, and the changes in Medicare are going to affect our local community greatly, especially here in Las Vegas, Nevada, with so many people being low income here and the changes in the economic environment. This is going to be crucial for them having that extra cash every month to help pay for the things that they need. So definitely do your homework, and if you've been sitting at home saying, I'm never going to make a change to my Medicare, This is the year to change that attitude. Get out the house. You've been, or have called, do a virtual visit via Zoom, or have us come to you, or do an outdoor appointment, or have your son or daughter call us, because if you don't take care of it this year, you could be missing out on huge benefits and huge savings on a monthly basis with these new plans rolling out.
Well, excuse me, I think water went down the wrong hole. But while you were saying that, I think the VA need to change the way they look at things, especially when they come to dental. Because dental affects your medical condition. You could get a heart disease from it. You could get brain aneurysm if you don't fix and you got some type of stuff going on in your mouth. And I think the VA need to take another look at dental as being part of the medical program. Because right now, as it stands, you have to be 100% service connected, disabled, before you could have any type of dental with the VA, which I think is sad.
And if you are VA, you should be calling and speaking with an agent, because actually there are plans that will help bring in that medical where they're lacking it right now. That's why a lot of VA people, they're like, oh, everything's taken care of. It's not. And that's why you need to talk to a Medicare agent, because they can probably get you a plan that will work with your VA benefits and supplement what you're missing. And that's really important. And you may be able to get dental where you don't have it now. So another good reason for VA people, even if you think you've got everything covered, what does it hurt to go 30 minutes to an hour and sit down with an agent and find out if there are more benefits for you that you're not getting, or money that you could be getting in via rebate form, and making your plans work for you. And if you don't take that time to look at it and really go over it, you could be missing out big this year.
And preventive maintenance, like let's say you have some type of mole that just popped up on your hand, and you're like, oh my God, that wasn't here 2 days ago. Instead of ignoring it for several years, you need to go to a doctor and say, hey, I got this mole on my hand. Let me see if it's cancerous or whatever, you know. But there's a lot of people that just wait till the medical condition worsens before they go and fix it. And when they could have fixed it, when it was just a small little thing, they could have had it fixed in and out. Instead, they wait. And now it's a major catastrophe, right?
I'm glad you brought that up, because I know a few people.
What happened to preventive maintenance, right?
I'm glad you brought that up, because I know a few elderly people who are the biggest procrastinators, and they're like, I'm not going, I don't want to go to the doctor, I want to go to the doctor. Okay, so here's a reason why you should look at your benefits, because one of the things they're doing now with their new plans, because they know these seniors are out there and they do that and they wait and they don't come in. They are now giving gift cards with some of the programs. $25 if you show up for your preventive care maintenance visit.
Really?
Yes, I'm not joking. And this is outside the benefits you get from the carriers. This is from the network of providers. They're giving you $75 for making your annual visit. They're giving you $25 for coming in for your 6-month maintenance checkup. They're going to pay you to come to your doctor's appointment for preventive maintenance now. It's almost too good to be true. I think people look at it and they're like, you're kidding me. They're going to give me all this stuff and do all this? Yeah, all you got to do is just go in and be an active partner in your healthcare and do that.
Yeah, because it's going to save them a ton of money. I could go on
That's
another
why they're
story,
paying
but
people to do that, because there are those people out there, and they want to take care of it on an early basis because it costs the carriers less money. So they're willing to incentivize you. So if you're not aware of your incentivizations, you're probably not even taking advantage of the benefits that you're entitled to. And if you don't know about them, you can't benefit from them.
So I take 12 vitamins nightly, right? 5 of those 12 vitamins are immune builder, right? To prevent any type of colds or blah, blah, blah from getting into. And I tell people, I said, why do you wait until after you get sick to say, oh my God, I need to take my vitamins? No, you need to take it before. You need to prevent it. You gotta keep the disease out of your body and not make the disease come in your body and then want to do something about it.
Thank you for bringing that up, because that brings up one of the biggest benefits of the new plans, which is called OTC, short for over-the-counter credit. And they're giving close to $120 a month with some plans to pay for over-the-counter things such as vitamins, holistic medications, pill boxes, you name it. They have these giant books where you can spend $120 per quarter. So every 3 months, this is use it or lose it. And many people are getting this money and they don't even know about it. And they're not even spending it. Exactly.
Healthy.
And the over-the-counter things like that are so important, and seniors aren't even aware that they have this money every quarter that they should be spending. One of the things the Las Vegas Medicare Pros does is we actually have a virtual shopper. So to make sure that the seniors take advantage of the $120 or whatever they're getting as part of their plan per quarter, we have somebody that calls them and says, hey, I want to help make sure that you get the max value out of your quarterly amount. Let me help you make sure that we're getting you things that you need and even stocking up on some things so that they don't lose that benefit every month. That's a personal concierge service that we offer our clients that I think many other agencies I wish would do, because seniors forget about it. They don't spend it until it's too late, and then they lose that quarterly benefit. We're not going to have that for our seniors. We're going to get the seniors the max benefits they deserve and help them make sure that they have somebody to help them shop for the things that they need with that over-the-counter credits that they get with these plans. And you don't get that with Medicare A and B, and you don't get that at the VA. You got to have these knowledgeable people to explain the benefits that you're open to and take advantage of them, because there are a lot and it will help. You're right. And the overall health care, preventive maintenance, vitamins, getting the things that you need outside of just your medical treatment services and care. And I want to be a part of people's lives and helping them as their partner in healthcare and making sure that they're getting the max value from their plans.
Well, Christie, it's a pleasure having you on.
It's a pleasure being on.
Could you look into the camera and tell people,
yes,
nutshell,
yes,
and your point of contact?
Absolutely. So I'm Christie Stucke. I'm a licensed agent with Las Vegas Medicare Pros, and you can reach us at 702-874-4444. If you have a group of seniors or a housing development of seniors and you'd like to have us come out with our mobile enrollment registration vehicle for a yogurt outdoor party, we can be reached at the number as well. You can also find us online at LasVegasMedicarePros.com. And if you want to find the mobile enrollment registration vehicle, we are all around town, and you can look on Facebook or Instagram or online and type in Find Merv or pound Find Merv, and you will be able to locate our truck and where it's at and meet us outside at an outdoor event in a COVID compliant manner to get information about Medicare and your plans in the upcoming year and schedule an appointment with a licensed agent.
And your point of contact, website? Or
yes, LasVegasMedicarePros.com is the website, so you can reach us there. And again, you can find us on Facebook or Instagram as well. And Find Merv is how you can find our mobile enrollment registration vehicle.
Well, Christie, thank you so much for coming on the program.
Thank you for having me, and I'm hoping that we can educate, and I'll be doing some more, I'm going to try the web, radio, internet fandom that you've done such a great job educating people, and I'm going to try to educate people about Medicare and medical. So I'm going to be doing some shows, and hopefully if anybody wants to tune in and find out what is a deductible.
What's the name of your show? Stucke with...
Medicare with Lucky Stucke, yeah. I'm gonna have to do that, exactly. Medicare with Lucky Stucke, and we'll go over basics of medical, healthcare, and Medicare.
All right, thank you. Folks, that's Christie Stucke talking about the Medicare enrollment. This is Steve Sanson, Jim Jonas with Veterans in Politics. Stay alive, stay healthy.